was initially diagnosed with noninfectious posterior uveitis about 23 years ago when I was in my early 40s. Before I became a patient at Texas Retina Associate, I went to about 5 different doctors to try and get help. It was a scary time for me. I didn't know what was happening, and I was really scared that I would go blind. The last doctor I saw finally referred me to Texas Retina Associate, who's been treating me ever since. Since I've been diagnosed, I tried different eye drops, oral steroids, and various steroid injections in and around my eye. At first, the injections were scary, but my doctor took the time to reassure me, and I eventually got used to them. My doctor was also the one who suggested that I take part in the YUTIQ clinical trial. He thought I would make a good candidate because my uveitis is chronic, and I was okay with getting injections every 3 months. He told me that there was a possibility that I wouldn't need injections for as long as 3 years, which sounded great to me. I really trust my doctor's opinion, so I wasn't worried about trying something new and being in the clinical trial. After the study ended, I was told that I was in the test group, which meant that I got my first YUTIQ implant in May of 2016. I thought inserting YUTIQ was a relatively simple procedure. My doctor numbed my eye with some drops, used a speculum to hold it open, and then injected the insert. I felt some pressure from the injector, but other than that, nothing. In fact, the entire process was over before I knew it. Since then, I haven't had any flares of my uveitis, and my doctors say that my vision has improved. And so far, I've been very satisfied with my results because I got the implants nearly 3 years ago. I recently had another steroid injection to treat my uveitis, but I will definitely be asking my doctor about getting another YUTIQ implant in the future.
Indications and usage. YUTIQ, fluocinolone acetonide intravitreal implant, 0.18 milligrams, is indicated for the treatment of chronic non-infectious uveitis affecting the posterior segment of the eye. Important safety information. Contraindications. Ocular or periocular infections. YUTIQ is contraindicated in patients with active or suspected ocular or periocular infections, including most viral disease of the cornea, and conjunctiva, including active epithelial herpes simplex keratitis, dendritic keratitis, vaccinia, varicella, mycobacterial infections, and fungal diseases. Hypersensitivity. YUTIQ is contraindicated in patients with known hypersensitivity to any components of this product. Warnings and precautions. Intravitreal injection-related effects. Intravitreal injections, including those with YUTIQ, have been associated with endophthalmitis, eye inflammation, increased or decreased intraocular pressure, and choroidal or retinal detachments. Hypotony has been observed within 24 hours of injection and has resolved within 2 weeks. Patients should be monitored following the intravitreal injection. Steroid-related effects. Use of corticosteroids, including YUTIQ, may produce posterior subcapsular cataracts, increased intraocular pressure, and glaucoma. Use of corticosteroids may enhance the establishment of secondary ocular infections due to bacteria, fungi, or viruses. Corticosteroids are not recommended to be used in patients with a history of ocular herpes simplex because of the potential for reactivation of the viral infection. Risk of implant migration. Patients in whom the posterior capsule of the lens is absent or has a tear are at risk of implant migration into the anterior chamber. Adverse reactions. In controlled studies, the most common adverse reactions reported were cataract development and increases in intraocular pressure. Please see full prescribing information.